to collect that data. So there will be a hotline that will be established by tomorrow morning. We've been working around the clock on this, and they are actually working on a program that it'll be web-based in the not too distant future. So I just want to give people an assurance that that is being worked on. So we have 10,953 new cases, but of course we think that there's absolutely more out there because of people getting a positive test at home. And we have 327 people in hospital, 14 are in ICU, and 3 people are ventilated, and the Chief Health Officer will give us more information about that in a moment. 36,492 tests were done in 24 hours, and our vaccine coverage is 90.93% at least one dose, and 87.26 people are fully vaccinated. And in good news across the state, 624,328 people have had their booster. Can I please say to people that now is the time to book in and get your booster shot. And of course, next week we begin our vaccinations for our young people. Of course, there is a lot of concern out there amongst parents about their children and return to school. Can I assure people that the Queensland Government is working actively on a plan. I've got a meeting with the Education Minister shortly after this meeting. I've been speaking with her regularly this week. National Cabinet is working on a framework. We're doing modelling in relation to the peak of this Omicron wave. And let me assure parents that we will not be sending primary school students back during the first week of school if we are heading towards a peak. So we are looking at a 1 to 2 week delay in relation to the return to school. We will give you more concrete decisions on this over the coming days, but I just want to assure parents that that is definitely not on the agenda to send primary school children unvaccinated to school if we are in the peak of this wave. This is a common sense measure, and like I said, that modelling is happening, and I'll update people about that. Now, a couple of things. First of all, can I strongly recommend work from home where you can? This has already been sent out to our public servants. Our frontline workers are out there working around the clock. But can I stress to employers, if you do not need people working in the city at the moment, please work from home. This will help slow down this wave. But I don't think this message has been getting out very clearly to employees. A lot of people at the moment are still on their summer break. Please go and enjoy your summer break, but do that responsibly, remembering we are in a pandemic. Now, what I don't want to see is people not wearing these masks. It is really important. If you are going to a cafe or a restaurant, you are wearing these going in. And it is very important that staff are wearing these as well. Just because you're on holidays doesn't mean you are not part of a pandemic. So please make sure that if you are sick, get tested and stay at home. It is really important, if you have any symptoms, please stay at home. Do not go to the workplace or to a party and infect other people. Okay, wear a mask and wear it properly. And we've said this before and we'll say it again, avoid large indoor crowds, especially if you are vulnerable. So my message, once again, to our elderly population is please restrict your movements until you've had your booster shot. So please stay at home where you can. We are going to reactivate the Care Army as well to help look after our most vulnerable. But everybody needs to make sure that they are watching very closely their movements. And if we do this, we are not going to stop this wave. This wave is going to happen, but we will make sure that we are keeping as many people safe as possible. And as we know, that in many young people and in most people, this is a very mild condition, but we do know that some people can get very sick. If you are unvaccinated, please go and get vaccinated. I've been looking at our map of where people are vaccinated. can I do a big shout out to Mackay? 95%. If you remember, Mackay region was one of our lowest regional centres when we first started the campaign to get people vaccinated. I really want to do a shout out to Mackay, 95%. Cairns as well, 92.9. Most Wide Bay, 94.1. Around Brisbane and the southeast, nearly every region is over 90% except for the Gold Coast. Now, we are seeing case numbers on the Gold Coast. If you are unvaccinated, please go and get vaccinated. If you have not had your second dose, make sure you get your second dose. And if you're due your booster, make sure you get your booster. Can I also make some comments about the rapid antigen tests? As I said, we have been procuring extra rats for people. So there have been 221,000 rapid antigen tests have been deployed to testing clinics. 150,000 were distributed yesterday alone. And we've also been able to source an extra 60,000 to be distributed into the regions over the next few days. And we expect supplies of 1.3 million by this time next week. I've also had reports that they are back on the shelves in some supermarkets. I know they are going very quickly. If I can please urge people to please take one box for your family and please use that if you have symptoms, because they are in short supply at the moment. But this is not just a national issue, it's an international issue in terms of the supply of these rapid antigen tests. Finally, in relation to freight entry requirements, following that National Cabinet decision, we've removed the requirement for freight workers and truck drivers to provide a negative PCR test to enter the state. This will keep our freight going. We are also having further meetings to look at essential workers in terms of keeping our food and freight supplies operating in this state. I think people can realise this is a very difficult time for Queensland at the moment, probably the likes that we haven't seen before. We have pressures that will grow on our hospitals. Thankfully, we do not see a lot of people in ICU at present, but I have health workers staff working around the clock. I have them working in our hospitals, doing our vaccinations, our boosters, also doing our shots for our children starting next week. Don't forget the GPs are also mobilised to do the vaccination as well. I have frontline workers that are out and about, and of course, if they test positive, they're out of action for 7 days. And of course, we have, which I think is nationwide issues with supply. But at the moment, we are monitoring all of this very carefully to keep the supply and the stocks on our shelves. This is going to be a short, sharp wave, but it is going to really test the resilience of this state. And I just want to assure the public that we are working on this every single day and looking at the requirements that are needed. The Health Minister will talk tomorrow about elective surgery in our public hospitals. Already some of our health and hospital services are making some reductions there. As you can appreciate, health staff are getting sick. And when health staff are sick, they are having to take time off to recover and get better. This is happening during the Christmas New Year period when some people are away as well. And schools are not operating at the moment, which is also comforting as well. So just want to assure Queenslanders that we are working on this every single day, going through all of these issues and also working with National Cabinet as well. So I'll hand over the Chief Health Officer and the Health Minister, and then we're happy to take some questions. Thanks.
Thanks very much, Premier. I'm just going to focus first on the hospital situation. Despite what we know to be substantial numbers of COVID positive people in the community, there are still only small numbers of patients in the intensive care unit, so that's very good. So we are only at 14 patients across all Queensland intensive care units with patients there because of COVID-19. That's up from 12 yesterday. There is just one additional patient on a ventilator. That's a man in his 70s who was not vaccinated. I believe that the main reason why we are seeing so few admissions so far to the intensive care units of Queensland is because of our very high vaccination rates, and probably also because the Omicron strain continues to become more dominant. It's now somewhere between 80 and 90% of the viruses that we're identifying. But that vaccination rate, particularly the third dose in the older age group, is probably almost certainly what is protecting us from much higher admission rates to the intensive care units so far. And again, I'm just going to reiterate the caveat, the rider that I'm going to put on that is that most of the patients that we are identifying so far with COVID-19 are in the younger age group. So that's the bulk, the 20 to 30-year-old age group. We still haven't seen substantial numbers of cases in people over the age of 70. The numbers of patients being admitted to hospital in general, to the general wards, continues to increase. It's at 313 today, up from, 313 in the 24 hours leading up to 7 p.m. last night, up from 284 the previous 24 hours. That's where our projections suggest we're going to see the biggest pressures in the coming weeks as we head towards the end of January, the beginning of February. We are expecting very substantial numbers of that intermediate group of patients who might require a relatively short stay in hospital, might require oxygen, might require dexamethasone, but not requiring the critical care. We will have much bigger numbers of critical care patients at the peak of this wave. I've no doubt about that. But we're not. There's a clear shift from the very severe to the medium severe type patient that we're going to be seeing. So we're treating 21,843 patients through the COVID Care at Home program. Our vaccination rates are continuing to climb. We're at 90.93% of the 16+ population with at least one dose and 87.26% with 2 doses. And if I could reiterate the measures that we want all Queenslanders to take to minimise or to attempt to slow the transmission of this virus, I would strongly suggest that the more vulnerable among us in the community, and by more vulnerable, I include anyone over the age of 60 or 70, and I include any pregnant woman, and obviously those with underlying immune disorders, to avoid crowded indoor spaces at present. Of course, as we've said over again, the critical nature of wearing masks indoors in all venues. To get that third dose of the vaccine when you're eligible, that's after the 4 months after you've had the second dose. And most importantly of all, if you are sick, if you are sick, please stay at home. If you are sick, please stay at home. Don't come to work. And I omitted one additional thing that we perhaps should be emphasising more in the coming weeks, particularly during January. If you're able to work at home, that would be a very good idea. Please work at home if you can, because we know transmission does occur in the work environment. I'll hand over to the Health Minister.
Thank you. So again, those messages are clear. There are 5 key measures everybody can take to reduce the spread of this virus through Queensland at this current time. And we want people to take these 5 measures seriously. First, stay at home if you are unwell. Even if you have given yourself a rapid antigen test and it's come back negative, that is not a reason to go to work or go out into the community if you are still unwell. It is highly possible that you initially get a negative rapid antigen test and then get a positive test at a later time. So please do not assume a negative test on its own means you don't have COVID. You should not be going to work. You should not be going to the to the shops. You should not be going out to cafes and restaurants if you are unwell. So please stay home even if you have that negative test. Work from home where possible. We know that if you work in confined spaces, in office conditions, and there's lots of people sitting around you on desks, that you are more likely to spread it when you're spending hours in that workplace. So stay home when you can and work from home. Mask wearing. Even if you're on holidays, wear the mask. It is mandatory for everybody to wear those masks indoors and wear it properly. I am seeing a lot of workers who either aren't wearing their mask in the hospitality sector or who are wearing their masks under their chin or not covering their nose. This will not protect you and it will not stop you spreading the virus to other people if you are not wearing your mask properly. That's number 3. 4, social distancing. We know this makes a difference, and I know over Christmas it's been great to catch up with friends and family and everyone's hugging and everyone's kissing hello. We need to get back to social distancing. You want to look after those loved ones. The best thing you can do is keeping your distance so you're not risking the spread of the virus. And lastly, get vaccinated. Whether it's your first dose, whether you're due for your second, or you're eligible for your booster. And if you are unsure whether you are eligible for your booster, if you have had 4 months, at least 4 months since you had your second dose, you can come forward now and get a booster. So please, your pharmacy, your GP and our vaccination clinics are providing these boosters as well as first and second jabs. The last thing I just want to say is we have 2 new local government areas that have reported new cases for the first time since we opened our borders. That's Carpentaria and Kawanyama. So again, this shows it is spreading everywhere across Queensland. We are doing everything possible following the plans we have put in place for our hospital system. We have a 5-tier escalation system. Most of our hospitals are currently operating on tier 1 to 3, which means they are taking measures to deal with staff shortages and bed capacity. But some of those hospitals that are at tier 3 now, those HHSs are taking measures to reduce some non-urgent elective surgery, but we are currently looking at whether we go to that next level of suspending elective surgery across our hospital system as we go towards that surge and the peak of that surge over the coming weeks. And I'll have more to say about that shortly. But I want to thank our hospital workers. I know that they are on the front line, our paramedics, our emergency and essential workers out there. They're doing a terrific job. We know many of them are testing positive themselves, not because they're necessarily getting it in the hospital system, but they're getting it in the community and they could be spreading it in the workplace. And I appreciate all those ones who are isolating because they're positive and also who are quarantining because they're close contacts.
Premier, yesterday, Dr. Gerard very honestly said to his colleagues that we're facing a state of emergency. Today's reaction or measures that you're putting in place as Premier, are we in a state of emergency here in Queensland?
The Queensland Disaster Management Group will be standing up next week. I think people know that we stand that up when we go through tough times, whether it's cyclones, whether it's a pandemic. And it is going to be a difficult time because everything is going to happen in such a short period of time. A lot of pre-planning was done for the Delta. We would have seen a peak spread over a much longer period of time, 6 to 9 months. What we're seeing now is all the evidence showing us that this Omicron is going to peak a lot sooner, and that has had to bring forward a lot more of our planning. You'll hear more about that tomorrow.
Just on the RAT test kit availability, given
yes.
how imminent the spike is, the wave, the Prime Minister came out after National Cabinet and said there's been a rejection of universal free kits. Is that...
Well, let's be clear. If you are a close contact, you can go and get your free kit at our health centres, our hubs. Okay, and then what I pushed very strongly, and I said it in the press conference here before National Cabinet, was that they should be free for our concession holders, our pensioners, people on support cards, and and that was accepted.
Mr Albanese, Federal Labor wants to go further and make them freely available to everybody. Do you support that?
I support it being available to the people who can least afford it, but also to those people who have become close contacts can go and get it free, and we're handing them out, as you know, freely at these centres.
At what point might Queensland consider bringing in some more restrictions? I understand New South Wales is looking at banning major events, shutting nightclubs and so forth to try and slow the spread.
Well, I think you've heard from the Chief Health Officer, the vast majority of young people have either had this or they're getting it because of their socialisation in these settings. What we want to prevent is we want to prevent our elderly ending up in intensive care, and we also want to slow the spread, which is why we're asking people to work from home. And I've said very clearly on a number of occasions to our most vulnerable in our community, now is not the time to be going out socialising. This is going to be a short, sharp wave. We're asking you to minimise your going out for essentially the next 6 weeks. That's not a big ask when you've seen countries and other countries around the world that have endured up to a year of lockdown. We're just asking our elderly, people who are pregnant, the most vulnerable in our community, the people who are compromised with their immune system, to think about very clearly over the next 6 weeks, basically not going out, limiting your movements.
So rather than restrictions, you're asking people to exercise their common sense.
Well, I think people know very clearly, well, in Queensland, we know that the masks help stop the spread. We also know getting vaccinated is stopping people ending up in hospital. And we also know that the boosters provide that extra protection. So people need to go and get their boosters when their boosters are due.
Premier, you said you won't send children back to school unprotected if the peak is approaching. What happens if children have 1 or 2 jabs, if they've had 1 vaccination?
There's going to be a national framework, but our modelling is showing that our peak will be around the end of January. Now that could change, okay? So we're doing all of that modelling, and that work happens on a daily basis. But the last thing is I don't want parents to have concerns. I've got sisters who've got young children, they're concerned, and they want to make sure that their kids are vaccinated before return to school. But also too, we're heading towards a peak. There may be staff shortages as well. So we've got to factor all of that in. This is going to be this January and February is going to be a very tough time for Queensland.
Premier, I know this is no time for politics, but throughout the pandemic, you've said, and the Health Minister has said, we've modelled ourselves off other states, South Australia for instance. You can't help but to look at New South Wales today. We've seen a Cabinet Minister come out and backstab Dominic Perrottet and say his decision to move forward in New South Wales is terminal. Do you think that if Dr Gerard says to you in the next few days, we need to do something before we end up in the situation New South Wales is in, you will bring restrictions back?
We are saying that now. We are telling people, please work from home. Please do not go out if you do not need to go out if you're in the vulnerable category. Please wear your mask. Socially distance where you can. If you are sick, stay at home. I can't be any clearer. Queenslanders have listened to these messages during the last 2 years of the pandemic. Now I'm asking Queenslanders to listen to these messages, but also visitors to our state as well.
So will schools go straight into remote learning, or will it just be a...
We'll announce that plan. As you can appreciate, a lot of work is happening, and we'll announce that plan over the coming few days. I'm focusing at the moment on getting our children vaccinated on Monday. I'm focusing on our critical workforce that I'll be having more to say about tomorrow. But we will release our plan for return to school so everybody will not have to worry. I'll announce that plan and everybody will know about it at the same time.
It takes 8 weeks for them to be double dosed. Are you comfortable with students going back with just 1?
Well, we'll take the health advice.
What would you say, Premier, to those people who think they don't have to get the booster shot because they've caught Omicron and that's going to trigger an immune response?
I might get the Chief Health Officer to talk about that.
What would you
Yeah.
say to those people who think that
Thanks.
their antibody response from contracting the illness is going to be enough?
No, our advice is still to get the 3rd dose. We don't know that there won't be new strains in the future. I probably do also want to say something about the density limit issue. We've been agonising over this, and I've been speaking to a number of epidemiologists about this issue for some time. We're not going to stop the spread of this virus. All we're trying to do is to slow it down a little bit so it doesn't overwhelm the hospitals and it gives more people an opportunity to get a third dose. The general advice that I've been getting is that if we're going to if we are going to use density limits, first of all, they would need to be quite draconian. I mean, a 1 person per 2 square metre limit is not much of a limit. Secondly, the demographic we're talking about, people in their 20s and 30s, the virus is already widespread. And I have not given advice to the government to reduce density limits, to reimpose density limits based on the information that I'm getting from speaking to a number of epidemiologists. Now, I acknowledge this is controversial, and others would not agree with this, but we are not going to stop this virus. And a minor change like imposing a density limit of 1 in 2 square metres, I think the evidence suggests that it's not going to have a major impact on the virus, but it would have a major impact on the greater society. So I have not given that advice.
Can we vaccinate at the school, doctor? Would that be the children? Can we vaccinate them at school?
Well, there is a plan being put forward for the whole vaccination program for children. There is one in existence.
But that would obviously be a logical idea if they could do it. If kids return back, maybe a question for the Premier, but it could be done, though, couldn't it?
I don't want to preempt the plan that will be presented here, I'm sure, sometime in the next few days, I would think.
You talked about the fact that the official figures are far.
Yes.
Far higher. Do you have any modelling on what it might actually be at this point?
No, we don't. I don't. No.
And how many health staff are now out because there is a sick or close contact?
In the Queensland Health, there are currently 1,156 staff who have been infected with the virus and 1,835 healthcare staff in quarantine.
Doctor, given the scarcity of rapid testing kits and the virtual shutdown of PCR testing to release the pressure on the private pathology clinics, what would you say to those people who feel as though they have to self-diagnose? The government's obviously ordering a lot of the kits to remove their availability from the shelves as well, to make sure the right people get them in terms of the priority. But what would you say to those who feel as though they've got to self-diagnose? Look,
obviously it's not ideal. The speed with which the Omicron strain has spread is extraordinary. So the requirement for these kits around the world is extraordinary. There's a very high demand around the world. Hopefully we're going to be getting more kits very soon. It's not ideal, obviously.
All the symptoms, what's the biggest giveaway? What would you say to them?
Oh, I think anyone at the moment who has any respiratory infection, that is anyone with a sore throat, runny nose, headache seems to be a dominant symptom, obviously loss of smell, cough, fever, they should assume they have COVID-19 until proven otherwise.
Can you tell health workers who are not able to be at work and the stress that's putting on the system, do you think that the 7 days isolation from close contacts should be removed for health workers?
We're putting in place various systems at various points of the pandemic where we might change those requirements. The US, for example, has a 5-day requirement, and I think for vaccinated even less. But so it may well be that as the peak of the pandemic approaches, our quarantine requirements, it is possible, will change. That'll be decided at a national level, likely.
Will that be likely for all essential workers?
There will be specific rules about essential workers that will be coming out soon.
So could we actually see, in extreme circumstances, people who are positive having to go to work?
It's possible that people who are asymptomatic and positive might be asked, for example, to work in a COVID ward. That's been done already. It's certainly something that is being discussed. It isn't being done at the moment, but that's the sort of thing we are making plans for, contingency plans for.
New South Wales has also got military personnel working in some hospitals. Is Queensland discussing that as well?
It's not necessary at this stage.
To the Health Minister, Minister, just to touched on over the last 2 days, and I hope I don't sound like a broken record, but we still see people lining up with symptoms. Can you just relay that message to young, healthy people yet again, so that they can help during this emergency, and that is to stay at home if you feel cool and try and fight this Omicron out?
Look, but let's be clear, we have said people who have symptoms are one of the groups that can come forward to get a PCR test. So I don't want people thinking if I'm sick, I can't get a test. If they can't get access to a rapid antigen test, we've made it clear, if you have symptoms and you can't get access to a rapid antigen test, you can come forward and get tested. What we don't want is you coming forward to get tested simply because someone else you know, who you might have gone to lunch with 3 days ago, has tested positive, but you feel perfectly fine. I know you want to know if you're positive, but the fact is if you have no symptoms whatsoever, you don't live in the same household as those people, then we're not wanting you to come forward to get a PCR test. If you want to get your own rapid antigen test and test yourself, you can do that. But if you are asymptomatic, and there are also some very unwell people who are worried about lining up for a long time. So don't feel they need to go out that day. They might be able to wait a day or two before they go out.
That would have to mean there's so many people lining up and so many people grouped around. Probably a super spreader event and people are lining up.
Look, and that's why social distancing, and can I say, when you're lining up for tests, I've seen some really good social distancing in testing sites, and I've seen a whole lot of people stand around with no masks on, near each other in testing sites. That is not a good thing to do. And to just give you a reason why, we did around 36,000 test samples in the last 24 hours. Over 10,000 of those came back positive. In other words, 1 in 3 people coming forward for a test are positive. So if you want to get an idea of what's floating out there, 1 in 3 people coming forward for a PCR test right now is positive. So assume if you have all those symptoms or any of those symptoms that the Chief Health Officer's talked about, assume you probably have COVID and follow the advice that is readily available on social media and our website.
What advice would you give to people who want to treat the symptoms without going...
Sorry, there's one for the Chief Health Officer.
Last two, just on the vaccination for 5 to 11-year-olds, when your GPs are struggling with supplies for that severely, how are supplies for the state run?
We have supply that should be arriving from the Commonwealth today. I'm waiting for confirmation. I've asked for them to tell me when the trucks arrive. There should be supply. The Commonwealth is, just like they have for the last 12 months, responsible for getting that supply delivered to our vaccination centres. That should be coming in today, with the vaccinations for 5 to 11 starting on Monday. So I know we're getting about 1/3 of the supply and 2/3 are going to primary care. So GPs and pharmacies will get the bulk of the vaccinations for the 5 to 11-year-olds.
Last one with the chat.
Doctor, for those people who don't need to be hospital, and there are many thousands hospitalised, many thousands of them, just over 300 in hospital, is that right? What would you say to them in terms of treating their symptoms? They don't want to go to the doctor's surgery or out while they're ill. What's the best thing they can do to look after themselves?
I think the main reason is... I'm sorry. Symptomatic treatment, so Panadol for a fever, maintain fluids, don't get dehydrated. But also, probably most importantly of all, is look out for the symptoms of any deterioration. So that's what we're most interested in. And in young, healthy, vaccinated people, that's very unlikely to be a problem. But in older people, those who are still unvaccinated, and those who are immunocompromised, increasing breathlessness, significant chest pain, coughing up blood, and if your fever and symptom, particularly your fever, isn't getting better within about 48, 72 hours, then you should be seeking medical advice. Most people's fevers are resolving within 48, 72 hours. If it's going beyond about 3 days, then I would be getting medical advice.
How soon might we have a better picture of actually how many people are infected with people calling in now and reporting that?
I'm hoping over the next few days, over the weekend, but we'll see.
Thanks, everyone.